Hello, everybody, and welcome yet to another episode of the Nailed It Ortho Podcast, your go-to podcast for anything orthopedic-wise. We try to go over high-yield topics, but this episode will be a little bit different. But before we get into it, you all please, if you have not, hit the subscribe button on iTunes or Stitcher, Google Play, whatever you're listening to. And then please go and leave a review. Our goal, especially if you have an iPhone or an Apple product, is to get to at least 100 reviews and ratings in the iTunes store. So please, if you can, just take a quick second to go and do that. Now, getting into our talk for the day, this talk is a little bit different than our normal weekly talk. This one, we're talking about setting up research in your clinical practice. So say you may be a fellow and you're just finishing up, or you may be a resident and you're thinking about somewhere where you want to end up. How do you go about setting up research in your practice? And I think this is a good episode, not only if you're a fellow about to graduate or about to be in a practice, but also if you're a resident, so you understand what the systems are like as far as how to go about setting about research and how to think about coordinating all the different factors of a research team. And we also have a previous episode going over kind of searching through the orthopedic literature with Dr. Mafuli. So if you want some more info on that, please go listen to our prior episode. But to get into our topic of the day, we have Dr. Nicholas Brown, who again breaks down how to set up research in your clinical practice. A little bit more about him. He did his med school at Columbia University College of Physicians and Surgeons. He completed his residency at Rush University Medical Center, and he did his fellowship at the Anderson Orthopedic Clinic in adult joint reconstruction. And he'll tell you a little bit more about where he did some of his research years or bouts of research during this podcast. So without further ado, we hope you enjoy this wide-ranging interview / episode with Dr. Brown.
You are now listening to Nailed It, the Orthopaedic Surgery Podcast, featuring Doctors Jamal Fitts and Wendell Cole.
Dr. Brown, welcome to the Nailed It podcast. We are happy you're here and looking forward to this talk.
Thanks for having me. Appreciate it.
Yeah, and we're talking a little bit off air, but typically for this podcast, we generally do talks on specific orthopedic topics like intro to total knees or rotator cuffs or ACLs, whatever. But this talk is going to be a little bit different, as we're going to kind of talk about like research and kind of be a little more discussion. But we'll definitely hit some high points and talk about how to set up research in your practice for any fellows that are just graduating or any residents that are interested in it. And kind of, why research and kind of just go from there.
Sounds great.
So I guess to start out, we were talking a little bit before, and you're just kind of telling me how far you are in your practice, but just for a little bit of background, if you could kind of just introduce yourself to people, let them know kind of where you did residency, where you're attending at right now, and just a little bit of background for you.
Yeah, sounds great. So Nicholas Brown, currently attending at Loyola University in Chicago. I do primarily joint replacement, but we're a level 1 trauma center, and I do a little work at the VA too. So a little bit of general ortho and a little bit of trauma in there, but primarily hip and knee replacements. Do a lot of revisions and that type of thing, and then also obviously do a decent amount of research on the side. Originally from Iowa, went to college at University of Iowa, then out to Columbia in New York City for med school. Then actually took a year off between my third and fourth year to go to Rush and did a research year with Dr. Della Valle, who's still at Rush there. And that's really what kind of spurred my interest in research and, taught me a lot about how to set up a successful research practice, how to be successful at it, how to do it. And sort of also, I saw him doing a lot of studies that were really impactful and that, kind of inspired me to get involved. And from there, I've just been involved ever since. So ended up sticking around there for residency, then went out to Alexandria, Virginia at Anderson Clinic. I did a joints fellowship. And then, I'm from Iowa originally. My wife is from Chicago. So found ourselves kind of back home in the Midwest.
Nice.
At Loyola in Chicago.
Perfect. And we're going to definitely get into, a lot of the things that you learned working with Dr. Della Valle here in a bit. But just to kind of start off, so what kind of are you? Is it kind of like a private academics model that you have right now at Loyola, or is it just straight like what is the
Yeah,
model just to give people some background?
yeah, pretty much a
Okay.
pure academic type place. I mean, we we do go over to um, community hospital kind of about 5 miles north and spend a little time at the VA. But yeah, it's a pretty traditional academic setting, which is what I was looking for, and I've enjoyed it.
Okay. And so what are some of the things that brought you into research, in general? Like what are some of the things that piqued your interest in why should people be doing research? Why should somebody do research? Why, I'm sure there's some people out there that just say, I just want to go home and just operate. But, we definitely have a lot of people that are driving the field and making changes. So I guess what do you think are some of the important things?
Yeah, no, that's an excellent question. I think, people get into it for, I think, a variety of reasons. And, there's nothing wrong with just not wanting to do it and wanting to operate. I mean, I think for me, that's my favorite part of the job and still what drives everything. I mean, somehow I sort of became the research guy, but I mean, still my first and foremost thing I enjoy doing is operating. And that's really what I'm passionate about. But I do enjoy doing some research on the side. So someone who just said, I just want to operate, that's great. That's, there's, obviously nothing wrong with that. So if you don't want to set up research in your practice, that's totally fine. But if you do, I think people come into it for a variety of different reasons. And I think it's probably a mix of reasons. I think, initially for a lot of people, it's just a means, means to an end, and that's fine. I think things are becoming more and more competitive. And I think having some research is helpful, along the way. I think for some people, they have to do it. If a lot of people like the academic setting for other reasons, teaching, just the other opportunities it affords. So I think, some people sort of need to do it. And then there's people, I think, probably more people who do it, because they really want to understand things, or they have a question and they want an answer to that question. I think for me, that it maybe started with those first two things as a med student wanting to get into orthopedics. But then the further you get into it and the further you understand how to do it and you understand the tools and the process, right now, most of the clinical questions or the research questions that drive me are things that come up in practice. And I think, man, I don't know what necessarily the right thing to do is in this situation, or I look it up and there's been maybe just a handful of things published on it. And it's an opportunity to say, what is the right thing to do here? How can I best treat this patient or this group of patients? Here's an opportunity to learn something. And it's those questions, that really drive me at this point. And it's interesting. It brings variety also is something, something else that I really enjoy about it. But for me, it's really being able to answer questions that the answers aren't known to, which is interesting and fulfilling, and I think also important to do to continue to drive orthopedics forward.
Yeah, I think you have to have like an inquisitive mind and wanting, just like you just said, wanting to figure out the answer to things. I know. I was with one of my attendings the other week, and we were doing a sports case. And at the end of it, we're like, I wonder if there's a difference between if you suture this at the end of the case versus not suturing it. And I wonder if patients do any better or patients do any worse. And bada bing, bada boom, that's kind of the inquisitive, thing that started off. And then, okay, well, let's go ahead and look in the literature and see what's there. If not, then maybe that's something we can write up and find the answer to it. That way, I'm sure we may not be the only ones that have this question, but there may be other people that have this exact same question.
Yeah. And, sometimes you look in the literature and won't find something, and sometimes you find something, but you'll just kind of think there's no way that can be true,
Right.
And then, it kind of gets you to want to research that question. And, I've definitely had that where I've looked at things and said, there's no way that's true. I've looked in literature, found a few papers that there's no way that's true. And then you do your own study and you're like, well, actually, yeah, maybe I should just trusted it. But, sometimes you do find something contradictory too, which is also interesting.
I was gonna say,
either way, one or two papers or three papers. I mean, how many papers do you need to read before you believe something? So I think even if something's been done, it's important to repeat it and verify it. And I think those are also, it's nice to do the novel study but it's also important to verify kind of existing, because how many things change, how many
Right.
things were just dogma and truth and they change. So I think those are also important types of questions to answer.
Yeah, and you took the words right out of my mouth. That's exactly what I was going to say, is that sometimes, it's good to recreate it and say, okay, well, I got those exact same results. So, it's just not something that that can be done in one person's hand, but can also be done in another person's hand as well. And so what, I know we briefly mentioned a little bit earlier, but can you kind of tell me the story of what got you started working with Dr. Della Valle, and how you experienced, or how that experience, I guess, changed you, or, kind of how you experienced everything?
Yeah, definitely. Yeah, no, that was an excellent year. I spent with him at Rush, and really kind of kickstarted everything in terms of research for me. It's like a lot of things in life. It's kind of, you just sort of fall into things. I was not totally sure what I wanted to do, as a specialty, and I was just kind of trying to figure things out. And I knew I was kind of interested in research, and, just sort of applied for it kind of on a whim, and got it, and ended up doing the year. And it was really one of the best things, for my career. It's it's interesting how a lot of things in life, kind of happen that way, and put you on a path. But, did a bunch of studies that year, and just really learned how to do, meticulous, careful clinical research. And, most of it was retrospective studies. And honestly, most of what I do now are retrospective kind of observational type studies.
Yeah.
I have a few sort of prospective things going, but there's a limit to how many prospective studies you can do, with, unless you have, a large amount of funding or personnel.
I was going
or
to
something
ask,
like
what was that?
So,
Okay. So it's funding that is kind of the main limit to
it's
type of
funding,
studies you can do.
it's personnel, it's time. I think, I kind of approach it a few ways. I think it's important to try and do some prospective things, but it's really hard to do yourself if you're going to. Even doing retrospective studies are really hard to do yourself. I think it really helps to have people, and sometimes those people are dedicated people that you hire or the department hires, and sometimes those people are medical students or residents or fellows. But I think it's important wherever you end up. This gets to kind of setting up what kind of the meat of what we're talking about. Wherever you end up, there's probably going to be people who are interested in doing research and interested in answering clinical questions. And a lot of people will want to put in some work, but it's hard to just do it all by yourself. So I think for me, one of the main things I did when I came to Loyola to try and get things going was just figure out who the key players were and figure out who I could connect with.
And how'd you do that? Was it a meeting that you held, or was it just by word of mouth? Like, I guess now we're transitioning to creating a team of people that that all want to do research. So how did you go about creating that team?
Yeah, it wasn't as like intentional as I'm making it sound, but I think I think you start doing a few projects, and through that process, you find the medical students that want to do it. You find the residents that are interested in doing it. We have a research coordinator, but then you have to start figuring out, who are the contacts within the IRB, that you can, to help kind of push these things through and get the studies approved. And you have to figure out, who are your biased statisticians that can help you, and how do you go through that process. And then, there's, in terms of, querying data from various areas, because a lot of it obviously starts with, how do you get the data? You may have an idea, but you still have to figure out how to get data. And sometimes you do need to go back and do chart review, but a lot of times there's, with electronic medical records, there's much more sophisticated ways of doing that through billing or through electronic medical records. So, you have to figure out if you're at a smaller practice, it may be someone in the hospital and medical records. At Loyola, there's people in bioinformatics. There's a couple people that know how to pull. So you have to identify, no one's going to sit down and tell you where these people are, who they are. You got to sit down and kind of get to know these people. Or a lot of institutions participate in in large kind of databases. So if you're part of the NISQIP or the NIS or something, you need to figure out who the contact is that can get you access, to that data. And then also, there's a lot of opportunities for sort of cross collaboration between, if you're at a university, there's people have biomechanics labs, there's, we're doing stuff with people in radiology, so there's a lot of people who are interested in it, but it's just a matter of, just like a lot of things in life, just making those connections and figuring out who's interested in doing this type of work and connecting with them. And then you can work as a team, because it's impossible to do this all by yourself. So I think, trying to search out and look for those people that are interested in, and just attending, if you go to grand rounds of like the research, the stat, for like in the biostats department does grand rounds and stuff like that. And you can connect with people that way. But sort of, I call it a team. I don't know if it's necessarily a team per se, as much as it is just, a network of people that are kind of like-minded, that also want to get that type of stuff done. And that exists in different forms in whatever institution you're at. So
now say, for example, we have somebody just completed fellowship, brand new, right out the gate, and they go and they join a private practice. Now, does that change the dynamics? Because, in academic centers, it may be a little bit easier to find, who the biostatistician, person is. Do you have any tips for anybody that's going to private practice that wants to start to set up or figure this out?
Well, I think, I think there's a few ways to go about it. Depends on the size of your practice. You may have partners that are interested in doing that. You may, even if you're at a private practice, you're still within a hospital system. So if it's a large enough hospital system, I'm sure there's a way of querying that data. Okay. A lot of hospitals, that's, publishing papers is interesting, but it's also looks good for a particular hospital system. So I think a lot of those places have incentive to help you. Some of those places may have a statistician. They probably have IT people, that can help you. Or also, I'm like right now I have one project going with a guy in private practice. He reached out to me. He said, my hospital wants to start getting more involved with research. It's going to be hard for me to do it myself. I know you're at a medical school. Maybe the three of us could connect. And so we have a medical student, a resident, me and him, working on it together. And it broadens our reach in terms of the amount of data we can collect. So, maybe he doesn't have the time to obviously collect that data himself, but he has the connections at his hospital. And now we have access to this large electronic medical record there, and he's get that data, we get data. So a lot of it is, I think people will say, I think a lot of it is just a willingness to do it or a want to do it. You hear a lot of people say, at just kind of, at Mayo or at HSS or wherever, they have this whole team and they make it so easy. And I'll tell you, maybe it's a little easier at places like that, but I was at Rush and people say the same thing about Rush. At Rush, they have a database and it's so easy and people do the data. And I spent a whole year there where, maybe it's a little bit easier, but, the places that produce a lot of research, that produce a lot of good research, it's a lot of hard work still. So I think it's just, and even if there are a little bit of advantages to being at certain institutions in terms of some research infrastructure that's set up, someone set it up at some point. It's not like this was just given to them. So I think, perhaps, at certain places, there's studies, you have to look at the feasibility of the study. Of course, like, there's 4 of us doing joints at Loyola. So, thankfully we don't have, as many infections as maybe other places do where there's 20 joint surgeons. So certain clinical questions we're going to be limited in terms of answering. So we don't try and answer those clinical questions. But that doesn't mean, that we can't, answer important questions and still meaningfully, contribute to our field and contribute to our literature, just because there's certain questions that based on our numbers aren't going to be feasible to answer. There's still a lot of questions that are feasible to answer. I've 40 questions I'm trying to answer right now. So there's plenty of things that, there are definitely ideas I have a whole list of ideas and say, I'd love to be able to look at that. It's not going to work here. But, maybe it could if I tried to collaborate with some other institutions. So, I think a lot of it is just a willingness and a want to do it and a drive to do it. And there's always going to be, questions that need to be answered that you'll have some means to answer. So I think it's just pick something. If you want to do it, pick something and just start studying it.
And just kind of just piggybacking off of some of the things you were saying, we're talking about, programs or places that have that infrastructure set up. Now, you having done, a research year and then, your residency at Rush, now you're at Loyola. Are there any, how do I say, maybe similarities that you note in the systems, in these systems that have been set up that you want to emulate? Or, is there anything, are there any patterns that, that you have noticed that these institutions do that you want to continue to do to make sure, you have a successful system that you're setting up?
Yeah, I mean, I think it's important to keep track of. It's helpful if you keep track of your own patients. If there's a way of, keeping track of patient information, complications, sort of just having that institutional database. If there's a way of automating, getting patient-reported outcomes, KOOS scores, hip and knee scores, things like that, pre and post-op. If you can set something like that up, that's that in and of itself can be challenging. But if you can do that, those types of things can be very helpful. But the thing I've noticed just at being different places, it's just, again, like I said, it's a drive to want to do it, and it's a willingness to want to do it, and just it's kind of
like mentality.
It's a mentality as much as it is anything else. I think from what I've seen being at a variety of places that produce a lot of stuff and produce good stuff, and talking to other people. I mean, I think, yes, some places have a little bit more funding and a little bit more infrastructure and have things set up in place to, collect some of these outcome scores and things like that. But again, it doesn't mean it's still, it's still going to be work, and it's also, I think a lot of it too is at places like that is, getting the residents involved, getting the medical students involved, getting the fellows involved. But a lot of that is also treating them well, treating them fairly. If they do work, getting back to them in a timely manner, not treating them as someone who just collects data for you, but treating them as a partner, in the research, valuing their thoughts and valuing their ideas. And I
these
think
are all like characteristics of a leader, at least from what you're saying to me when I'm listening to what you're saying. These are all characteristics of good leaders, in different organizations that they have, that they care about the people that work with them and they value their ideas and actually listen to those ideas. So it's almost, in one part, you have to help develop the leadership skills yourself, but you also have to pay attention to each person as a part of your team or part of your program.
Yeah, it's interesting. I hadn't really ever thought about it exactly like that, but it is really true. I mean, I think, people think the hard part about research is like maybe coming up with the ideas or, gaining access to the data or something like that. And that can, but there's, the further you get into it, and the further you get, subspecialized into a field, there's a million ideas. The easy part's coming up with the ideas. The hard part is, the logistics and the management and just continuing to get people working, and most people are working for free, right? Like,
correct.
Part of that is, when I talk to other people, it's like, you have a resident or a med student who's put like 50 hours of their time into this project for like, maybe to get their name, to have a line on their CV or something like that. So, you have to really respect their time. And if they have a question for you, I give everyone my, everyone has my cell phone number. I'm like, call me anytime or text me or email me if you ever have a question, because you're putting in so much work for me for minimal reward, I guess. I don't want to say minimal reward. The reward is, hopefully it, it helps whatever they need to do. Maybe it's personally satisfying to them, or it helps them career-wise, or to match into residency or fellowship, whatever. I mean, it's not like it's totally altruistic on their part, but I mean, it is still a lot of work. And I think it's really, really important if you're going to try and do research and try and, because you need people to do that, you have to just really still respect their time and respect the amount of work, that they're putting in. And
Yeah.
that's been really, for me, that's been really important.
Yeah, that may be one of the unspoken, key parts to creating a good team is having that mindset of, you respecting everybody else's time, respecting them, and trying to, realize that, just like you said, nobody's really getting paid for this unless you have a paid position. I know some places have that, but everybody here is just, we're all just kind of inquisitive minds that want to at least try to make the world a little bit better and push research and push ideas and thought processes. Getting down to the nitty gritty, I know you mentioned setting up something to keep track of your own patients. Is there anything that you have set in store? Is this maybe a particular program or something that you set up with a nurse for those that may be listening that want something concrete that they could try to do?
Well, yeah, I mean, it's interesting, kind of like we sort of talked offline briefly about, is that, I know we're talking about setting up setting up research in your practice. And it's kind of, I'm doing a decent amount of research now, but I'm also, me and, definitely some of the other people in my department that are interested in doing this type of thing we're really trying to kind of push this forward and really we're sort of in the process of setting it up right now. I found, for me, in terms of like gathering data, we use Epic, and if you have a good bioinformatics person, they've been really, really helpful. The two at Loyola, really, really helpful at querying data, and it's part like knowing the system and part computer program. I don't fully understand it, but they seem to be able to get, they've been able to get really pretty good data for me. And right now we're also, there's a lot of different kind of companies popping up that are able to, sort of automate and email or call patients a lot, or have them do it on like an iPad, or there's a variety of ways of doing it to get those, kind of pre and post-operative scores, depending on whatever, subspecialty that you're trying to, collect for. So I think just learning how to query the whatever electronic medical record you're using, and then for me, it's also being careful when I code everything. So anytime I see anyone in clinic, I'm really careful with putting the proper diagnoses in there, and ICD-10 codes and CPT codes and stuff like that, knowing that down the road that's something that has been really helpful for me to go back and query it. So at first I started keeping my own kind of database of surgery, but then I realized if I accurately documented stuff in the electronic medical record, they're really good at querying those. And then also, we've been doing some stuff with the radiology department, and one of the guys over there is able to use natural language processing to look through all the radiology reports. So that's, we have a project looking at that, and we're able to query just a huge number of x-rays based on, natural language processing, certain keywords and things like that. And then we can go back and look specifically, verify it by looking at those x-rays. So again, a lot of this stuff is getting creative and just knowing your own system. So you may be at a practice where you need to keep your own file of all the patients and surgeries and complications, things like that. Or you may be at a place that you can do that in the electronic medical record. Or you may be at a place where you can creatively look through clinic notes or something with now with more kind of sophisticated computer-based ways of doing that. So I think it kind of depends on the setting a little bit as well.
Yeah, no, I think those are all just solid tips. I think one of the things that an underlying a common theme that I'm seeing here is documentation, is having very good documentation of of the complications of the conditions, of coding, making sure the codings are correct, setting up, making sure you have the documented questionnaires for whatever it may be, like the CUS questionnaire that you're talking about for knees, or the ACES for shoulders, so that with every patient you get, you have something pre-op and post-op. If you have imaging, you have your imaging system set up, you have them at these time marks. So now you say, well, maybe I know on all my patients I get imaging at 1 month, 3 months, 6, 9, and 12. So maybe you could do a study looking at some types, something in imaging of some sort, but it's all kind of just having a system set up with good documentation is what, I guess the overlying undertone is, one, you also mentioned the companies some companies call patients the natural language processing. And, if you have an EMR, definitely file complications.
Yeah. So I think, like you're saying, it really depends on your practice setting. But just again, just to make sure you have stuff documented, because otherwise you're not going to be able to ever get that data. So
perfect. And just moving on to, I know we briefly mentioned a little bit earlier, but how do you choose a feasible study? Like, how do you choose, like, how do you know, like, okay, this is probably something we should do? Or is it resources? Does it say, well, we may not have the resources right now, and you have to look at certain type of funding? Like, how do you choose a feasible study?
Yeah, that's a good point. I think it's it's a variety of things. I think you have to look at how common, and there's ways of doing that with power analysis and stuff, how common this outcome is, and what your numbers are going to be for like a retrospective type study. Or for a prospective study, you have to be honest with yourself in terms of, do you have time in clinic or time in pre-op to consent people? It takes time, it definitely does. So, for the sort of prospective studies I'm doing, it's either a medical student in clinic that's doing most of the consenting and explaining it, or a resident or a medical student in the pre-op area that's doing it. So you have to, if you want to do those studies, you have to just sort of like think about what that exactly means in terms of your clinic flow or your preoperative. For me, it's hard. Like, there's certain things, like it's just kind of like one of the things we're doing just involves like taking a picture of the knee and how that affects range of motion and physical therapy. But it's still weird for me in like like people are nervous right before surgery and stuff like that. So the last thing they want to do is have their surgeon talking to them about, the study they're thinking about doing, so you have to think about, so right. When I go talk to them, I want to just go over there and tell them, I'm going to take excellent care of you. I'm not going to leave the OR until your knee is exactly how I want it. Your hip's exactly how I want it. I do a lot of these. I get good results. We have excellent anesthesiologists. I'm going to, it's going to take, this long. I'm going to talk to your family as soon as we're done. I'm going to take great care of you back there. Don't worry. Just trying to kind of calm them down, and then I'll let the medical student say, hey, we're doing this little thing. If it's okay if we take a picture of your knee, and but the same thing in clinic. Everyone's clinics are busy. It's busy. So if you think, I'm gonna do this study and I'm gonna consent people. I'm gonna talk to people about it. I'm gonna have them sign these forms, and I'm gonna put their name and MRN in this like database, and I'm gonna randomize them, and then depending on where they're randomized, we're gonna do this versus that. It takes a lot of time. So what I've realized is, occasionally I'll have days when I don't have one of the medical students on one of the projects with me in clinic, and it it really can slow down the flow. So, you just, right. In terms of feasibility for prospective stuff, it's just really, it's great. Sometimes you think of an idea and it's really exciting and you want to do it, and I wouldn't never, discourage someone from doing that, but you also have to think about how that is going to affect preoperatively or clinic, kind of flow and what that means in patients that are already like, anytime, it's like you just talk to someone. A lot of people are really nervous about like getting surgery, and then you sit down and talk to them. Hey, we want to do this study on you. And even if it's like the smallest, like one of the things is like, all we're going to do is call you. Like it's a 5-minute call 6 weeks after surgery to see, your pain levels and how many of your opioids you took and all this type of stuff. And we're trying to but even it's like, it's literally, we're just trying to consent you for a 5-minute phone call or a short online survey. As soon as you say, we want to do the study on you, you have to choose your words really carefully. So, but I think, things like that is just in terms of feasibility, is thinking, how common is this event I want to look at? You can have, there's online power calc, but really you need, it helps to, consult a statistician like at the beginning And then for those other type of studies, think about what that means for your day-to-day life.
Yeah.
Be
And
my 2 points.
And so consulting a statistician at the beginning, is that to help you organize how you would collect the data? I guess what is that? What part does that play?
Oh, I think it's incredibly helpful. And that's something I've learned working with some of the kind of excellent statisticians at Loyola is, people think about statistics and data as purely analysis, but I think, really good studies and good answers come from good questions and good data and proper design, not like overly sophisticated statistical analysis. So, almost any statistics book you read starts with, like a statistician's role is as much in proper design and data collection and implementation of a study as it is in data analysis. I mean, I think the data analytics part is just one piece of the puzzle, whereas a lot of people come to a statistician afterwards and say, hey, can you look at this? But they, especially the really well trained, we have PhD statisticians. I mean, they have a lot of training in, there's a lot of things you wouldn't think about in terms of just biases and how you randomize and how you set up even the wording, on questionnaires. And there's a lot of things like that they can really help you do a much cleaner study. And then it's so much easier for them to analyze the data on the back end. And I think, I've never had a statistician say, oh, why are you coming to me now? Come to me when you have the data. I mean, it's almost always the other way around. They're like,
Right.
okay, well, why are you coming to me now? Like, there's so many problems I could have foreseen at the beginning, but now you're coming to me at the end. So, I mean, if that's one thing I've learned just working with, really talented statisticians is that their skill set is is probably wider than most people. Their skill set and training is probably wider than a lot of people realize. So consulting them early has been really helpful to me.
Wow. Okay. No, that's definitely a good tip. For all those listening, I hope you wrote that down. I think that's something that I have done once, as in not consulted them as soon as I should have, and done it more on the back end. But since we're talking about that, and I think that was a great point. Can you kind of just walk us through, I guess, kind of your flow of things? You're talking about you go and talk to the statistician. So is it when you have an idea and you figured out kind of what you want to do, then you talk to a statistician, and then I guess what is the flow from there till published, like overall, like how do you?
Yeah, that's good. That's a good question. I mean, usually I'll anytime I just think of an idea, I just write it down, and I'll write it down on my phone, or I just have like a running Word document. And then for it's probably like songwriters or something, for every like 10 songs they write, maybe there's one good one. So I just write it down. And it comes to my head, I just write it down. And then I'll come back periodically and sort of revisit that list. When I have a medical student or resident that comes to me and say, hey, I'd love to get a project going. So then I'll kind of look through the list, look through what seems to be a reasonable idea. And then from there, I usually kind of try and vet it a little bit. So then once I have someone interested in, I'll think about it. And it seems like it should be obvious, but just spending like a little bit of time with a pen and a paper, just thinking about it and trying to map things out can really be helpful. So then once I've done that, I'll usually go to the literature and also have who's ever doing the project kind of go to the literature and just see like, is this like a question that, sometimes it's been answered enough times, or, depending on if it's like not that important of a question, if it's been answered, you maybe don't want to do it. But if it's a really important question and you feel like it's been incompletely answered, then I'll kind of proceed. So then from there, usually it's, get them, there's always a lot of kind of lag time. So I think like a lot of these things happen kind of simultaneously, but it's, get the IRB going and start putting a spreadsheet together, and then sort of hopefully while that's getting done, you can put in a request for stats, and hopefully around the time the IRB is done, you can talk to the statistician, and then you'll have a spreadsheet put together, and you could say, this is the data we're going to try and query with our bioinformatics people. This is, if you're doing a retrospective study,
Right.
and then they can kind of help. Oh, did you think about it? And sometimes they think, because they work with, they're cross, specialties. So sometimes they think of things that like you might not have thought of just because they've done studies in other specialties, or they think about like, oh, would you do this as like a survival now, or so they sort of think of
Yeah.
things that you might not think of, and like little data points you might want to collect, and then collect the data. Invariably, even these places that have these institutional databases, it's incomplete data. Like there's no way you could foresee every possible data point you would want and put it in a data. I mean, you could, it would take forever, right? So
Yeah.
even if you have an institutional database, you're still going to it's probably going to require a decent amount of chart review. So then, at that point you collect the data, and then, go to the statistician. They can usually get you a good, analysis of it. And then, from there, write it up and work on getting it published.
Okay. And just since you just mentioned it, and that's the last thing that you mentioned, I know we want to talk about it, publishing options. What can you expand on, how to figure out where to publish, what to publish, and kind of all that goes through your mind when you look at publishing and what you're thinking about?
Yeah. I think, it's interesting. There are now, even, the residents use it more than I have, but there's like, I don't know if you call it artificial intelligence, or there's things now that you can, in our library, you can do it through the library. They have access to it, where you'll punch in your abstract, and it can give you a list of journals that are best for you to submit it to.
Really?
That'd be one. Yeah. So that's kind of
Huh.
interesting. I don't know how it does it, and how accurate it is, and if it's been vetted. But definitely, you're seeing things like that coming more into the forefront. But then I think, the more of this you do, you sort of get a sense of like, there's kind of like sort of like orthopedic journals that are, considered like very, like JBJS, core, things like that. And then there's like your sort of top subspecialty journals. And then there's kind of like middle tier journals. So I think sometimes it surprises you what gets into one or not another one. But, in general, you kind of, if it's like a, I mean, you kind of know, it's kind of like a little bit of an art of which journal to go to, but it's a little bit like looking at, have they published something recently on this topic? And if so, sometimes it's a hot topic, so you might want to kind of send it to them, or it's kind of been done in that journal. So then, if they recently published something on it, but it's not like a super hot topic, you might want to go elsewhere. And then just based on, how novel the idea is and how large of a study you have, you can kind of go from there. But I think, the more of this you do, and it doesn't hurt. I mean, I don't, never hurts to kind of, I guess, to aim high, but it's also, I think when you do it for a while, you kind of get a sense of where a decent home, and the more you kind of read the different journals and are more familiar with the literature, you kind of get a sense of where a decent home, for a paper would be. But I think it all starts with also is just asking a question that people would be interested in or want to know the answer to. I think a lot of it just comes down to, is this something that people care about? So, I try and, when I'm coming up with a research idea, I don't really like to do it. Occasionally that'll happen where you'll just do something for the sake of doing it or something like that. But I mean, really, you're trying to think of like, this is a question that is important to be answered, that like people would be interested in, or maybe people wouldn't be, but maybe you are, at least, So, I mean, almost everything I'm doing, it's something that I said, I wonder what the answer to this is. And I want to know the answer. And that's why I'm doing the study. And I think if you yourself are true to yourself in terms of having that attitude, then you're going to be more likely to get it published. Because if you say, this is an interesting question to me, it's probably an interesting question, to someone else. But if you're just doing it for the sake of doing it, you're probably going to have a hard time. So I think those are things to keep in mind.
No, yeah, that definitely makes sense. And I remember the first time where I was very, very much a novice in the field of research. I think I was a first year med student, had no idea what research was really, but had an abstract and wrote like a manuscript and was trying to figure out where to publish it to or where to send it to. I didn't know anything about like, impact factors or journals or top journals or anything. And I think some random journal sent me an email saying, "Hey, do you want to submit to this
Yeah.
journal?" And I submitted mine, and they're like, "All right, perfect. It'll be a couple grand." And
Yeah.
I was like, "Oh man." Yeah, it was just one of those, I guess you could call it one of those no-name journals as of right
Yeah, I
now.
mean,
But
there's definitely I would say there are good journals that are open access.
yeah,
So there's two types of, I mean, there's journals that are either have a nominal submission fee just to kind of limit the number of submissions, or are free and are, they are sustained via, via advertising, or I don't know, maybe donate. I'm not exactly sure where some of the funding is come, but there are good open access journals that just, and they have a good mission. They want to produce a good product, and there's just only so much money, but it allows, people and, anyone access, private or academic or developing world, access to that information. So I think that's, there's nothing wrong, with open access journals that have some fees, but then there's obviously like, predatory journals that are
yeah,
like barely even real journals.
yep,
So, and I think a good open access journal is going to be upfront about that. It's easy, if it's easy to figure out how much it costs to publish in there, it's probably, a lot of times it's probably a reasonable journal. But when it's kind of like a hidden fee or after the fact or something,
send us your PayPal.
yeah, it could be some kind of like,
Yeah,
there's definitely sort of these predatory, predatory journals.
yeah. And the last thing before we wrap up here in the next couple of minutes is setting up funding. Do you have any tips for, maybe a resident or a fellow that's just coming out that has this idea that has no idea how to get anything funded, really hasn't done that before? Are there certain places they should start with, certain resources, or I guess any advice or tips that you have for them?
Yeah, there's and that, this is something I, probably need to be better about myself, but there, I've worked on some projects where some residents have gotten funding, and there's a variety, especially for residents, there's a variety of sources. I mean, there's a lot of most of the like organizations have resident funding, like the regional organizations, like MAOA, I'm a part of, has a funding for residents or new attendings, OREF. I also think that, sometimes you can even get, things donated from companies, and a lot of institutions, even, and they don't always advertise it. Like Loyola has different funding for medical students. There's funding for residents or new investigators, and even some departments have almost like a little slush fund of funding too. So I think it's a lot of the stuff isn't just like, out there totally advertised, but if you have a good idea and you have a will to do it, and it's going to take a little bit of money to do it, and you're honest about it, there's probably ways to get it funded. So I think just searching, those different avenues, there's oftentimes kind of money out there.
Yeah, and I've noticed there's a lot of different organizations will have funding for certain amounts, $5,000, $10,000, depending on the organization. There's there's NIH. There's a lot of different places that you can seek when you're looking for funding for whatever projects you may be undergoing. Is there anything else before we wrap up here that you think somebody should take away after listening to this episode?
I think, I kind of touched on it. If they're, I think the main thing is just, a lot of it is just a mentality, and there's ways, if you're interested in doing it, it's just a matter of doing it. I think it's just, at every place, in any setting, some places, again, have a little more infrastructure or a little more data, or it's slightly easier. You can ask different clinical questions, but I think in almost any setting you're in, if you're interested in doing it, there's important questions that you can ask, and and answer. And they might be different questions depending on your setting, but then at the same time, because you're in that setting, you may be able to answer questions that other people can't, even in larger, better funded places. So I just think, if you have the will to do it, I think you are able to. Most people would be able to meaningfully contribute. So I think it's as much a mindset as it is, anything else.
Well, Dr. Brown, I really I learned a lot actually just from having this conversation and talking. I was taking notes while we were talking, so of things that I'll probably use when going forward. But I really appreciate you coming on the podcast and coming and talking about research, tips to get started in research, and kind of just even a mindset to have when you want to get involved in research and creating a team. Now, we always ask our guests, anybody who wants to reach out to you, whether it be social media, email, or anything. Is there any way that people can follow you, or if you don't have anything, that's fine. If you do, that you want to share with the people, that's great.
Yeah, I feel like, anyone wants to contact me, feel free. I guess probably the best would be, I don't have a huge social media presence.
No problem.
I'll tell you the
That's
best way
fine.
to contact me. Actually, I'm involved with. We're starting this app. It's called Teamed Up. It's on the Apple Store right now, and it's a way of kind of sharing cases and communicating in a way of like kind of creating groups. And that'd probably be a great way to communicate with me, since it's a new app I'm a part of kind of developing, and it just came out a couple weeks ago. So it's called Teamed Up, TEAMED Up. Yeah.
Teamed Up. All right.
So I would say, if you want to communicate with me, you can easily do it through the app. But if not, also check it out. I think it's got a lot of promise. It's a cool idea that we've been developing.
That is great. Well, Dr. Brown, we appreciate you coming on. For those listening, thank you all for listening. We hope you enjoyed this episode. Please, again, tune in next week. Subscribe, leave a review. Thank you so much, Dr. Brown.
Thanks so much for having me.